So
what are they doing that is like for an example, and not to be critical of hospitals and things, but let's say the budesonide, are they using it? We know a great people like Dr. Bartlett in Texas. He's using budesonide and using it as a frontline medication to open up those
budesonide
airways
really
to
does
help
help
people
because it
breathe
reduces the
better.
inflammation in the lungs. It reduces the swelling. And with that reduced inflammation, people breathe better. It's a steroid. So you get all these benefits from it. And I think it's very crucial. It has to be given on a very consistent schedule. Twice a day is not enough. It really depends on how the person is, but by doing it properly, I've seen it help lots of people. It doesn't help 100% of the time. It depends where they are in terms of COVID. There's 3 steps with COVID. There's, the first step, stage 1 is infection. You feel like you don't feel good, flu-like symptoms. Step 2 is inflammation. And then stage 3 is hyperinflammation. And so if someone's in hyperinflammation, it's hard to treat them with, they need more,
AKA cytokine
they're in the
surge.
stage 3 cytokine storm. Now, there is some evidence, literature that shows that budesonide may help with cytokine storm. I'm not saying it does, but I'm just saying it's a phenomenal thing. I wish all the hospitals would embrace it. It's very cheap. It doesn't cost a lot. And I feel it should be in every home. You know what I mean?
And I've read the studies. I'm gonna ask those healthcare providers that are watching, what does it really hurt if they're not allergic to them, and you give 20% of all the medicine you prescribe, guys out there, whether you're an MP or a doctor or a physician assistant, that it's off brand label. 20%
of all prescriptions in America are off label, Joe. So that's pretty much a statistic that's been consistent over the years that 2 out of 10 prescriptions are off label. But if you're treating ARDS, acute respiratory distress syndrome, right, which is kind of like pneumonia, their breathing, there's lots of inflammation, there's cytokine storm going on. There's why not budesonide? What do you got to lose? You know what I mean? I've seen it do, in my opinion, miracles on patients. I had a patient whose pulse ox was in the low 80s, and then within 24 hours, it was 98.
Well, we're going to take a break real quick, and we're going to talk about your webpage. With your permission, we want to educate people, show the web pages, and where they can reach them. And we'll be back after these messages, and we'll just take a minute to look over everything as I'm narrating it. We've got your website, and if you please want to help narrate it with me there. What we're looking at is the number that's on there, the success stories, the type of medications, the sort of protocol. Now, some people might be a little bit critical and say, well, it sounds like it's like a menu ordering it up at Subway. You're either going to take this medicine or not. What would you respond to that?
It's a patient's choice. We've seen, you could go to budesonideworks.com. It shows all the white papers and literature. They give this to 2-pound preemie babies in the NICU, budesonide. If it's not harming preemies, how's it going to harm an adult, right? That's my opinion. And so I feel, it's optional, but, I'd rather be at home on neb treatments with budesonide, Joe, than sitting in the ER. You know what I mean? And
we've lost too many people. We've lost too many people.
Yeah. And so early treatment is key. Keep it boring, is what Dr. Bartlett always says. Keep treatment boring. Just think of it as if you have a leak, if you live in the top floor of a building and there's a leaky pipe and if you're on the first floor and that water's dripping down, if you wait too long, it's going to turn to mold. So you got to bust open the walls, air it out, fix the leaky pipe on the top, and and make sure mold doesn't grow. So that's my analogy is, you got to treat early before it turns bad. Because stage 3 hyperinflammation is so much harder even in the hospital to treat with COVID in terms of COVID or pneumonia from COVID. So
As a nurse practitioner, what are you seeing how the with COVID in Europe and things, as we're recording this right now, I hate to date my programs, but it's going to be late summer of 2022. And there has been variations.
Variants going around. There's BA3, BA4, BA5. BA3 was not as symptomatic. People would have it. They may not even get tested because they're, just a minor cold. But now BA4 and BA5 are coming around. And then there's more subvariants, but we're still in the Omicron family. You know what I mean? Just cousins of Omicron. You know what I mean? We're not even at the next variant yet. I don't think COVID's over. President Biden just extended the national emergency July 15th. They they extended it. So, technically it's not over, right? I think it's, I read an article when this COVID first started in, 2020 on CNN of all places, but it said, they estimated COVID would last 7 years. And I don't know, maybe, I don't remember who wrote it. Yeah, but who knows? We're already.
What is this? The 7 years of tribulation? I mean,
yeah, I don't know. I'm not
out,
I don't know, but all the subvariants and stuff like that. So the key is just be prepared. Have a box in your house of of things. I recommend every home have a nebulizer. If you want one through us, we could ship one out to you. Through Synergy Health DPC, but I recommend every home because pharmacies refuse to have them in stock. I think it's a shame. I feel every pharmacy should be required to have nebulizers in stock. In certain states, you need a prescription for it, which does make sense, but they don't keep them in stock. You know what I mean?
What about the doctor? The pharmacy saying, all right, they sent this. You have doctors that are writing the prescriptions in every state, right?
Yeah.
I mean, you've got the nurse practitioner, you've got the physician, you've got in some states you need to collaborate with a physician. In other states like New Mexico, a nurse practitioner can practice independently.
Yeah.
So you're having to look at the conflict in laws, and of course you're maintaining the ability to keep up with the information. But for those out there that are thinking that there's not a doctor or a nurse practitioner watching over this, that you're just going to order it magically like a fire extinguisher, that's not right, is it?
Correct. We have collaborative physicians for the nurse practitioners that need it, and then a lot of states now have full practice authority for nurse practitioners, so they no longer need a collaborative physician. So nurse practitioners are becoming more mainstream, and I think it's good for us MPs like you and me. So
yeah. I mean, when I first came out, it was virtually unknown, and now many patients see nurse practitioners for their primary care problems and other care problems, and I think they're doing a wonderful job. We've got a few minutes left, but now we've done it in Spanish. We're going to do it in English, and then we'll be back and do it in French and Portuguese. Just kidding. What would you like to tell the people out there? What's the fastest way to reach your company, get involved in the program, receive the medications at home, and have more control over your medical treatment?
Well, they could go to our website, Synergy Health DPC, check out our services. We do it based on how sick someone is. So the sicker you are, you could get cut to the front of the schedule. Just costs more. And then, but they can register online, sign the consent form, book an appointment. And, one of our nurses would call and triage the patient, and then a nurse practitioner would call and assess the patient. And it just don't wait to be like, there's a fire in the kitchen and then you have to go to Home Depot and get a fire extinguisher, because sometimes things take time.
They do.
For example, I've had patients have trouble getting a nebulizer. A nebulizer is the key number one thing that people need in their house to stay out of the hospital, who may go in the hospital for pneumonia, right? Or ARDS. So it's so important to have a nebulizer. Pharmacies don't have them in stock, Joe. I've seen it all time and time again. They say, we don't carry them, we don't have them, go to a specialty supply. And they make it so hard for patients to get a nebulizer.
And everybody out there, extintor de incendios is fire extinguisher.
Yeah, yeah. So nebulizers are very important to have. I've had people wanting to get them as Christmas presents. I think it's life-saving. Every home should have a pulse ox and a nebulizer in the house. I have 2 in mine. So, we all have smoke detectors on every floor of the house. I think you need at least 1 to 2 nebulizers in the house, a pulse ox, equipment. Get it now. And God willing, you shall all be blessed that you never have to use it. It should stay on the shelf in the closet collecting dust. But if you need it, it's there. That's why, same thing with smoke detectors, fire extinguishers. We shall be blessed. We never have to use it. But it happened to me once. One of my kids put something in the toaster oven. It caught on fire, right? Thank God I was home. And thank God I had one of those mini fire extinguisher cans. And I caught it before it spread. And that's how, most illnesses are. You got to be proactive versus reactive. And, old school America is being reactive. You don't go, you don't get access to healthcare till there's a problem. But I think it's important to have like, a box, of things in your home, nebulizers, at least some basic, just like a first aid kit. You're not going to be bleeding and running to Target to get Band-Aids. You need things in your house. So that's why that's my take home message is get the things you need to be prepared.
And the email, if they want to, the website they go to, plus the email, if they want to.
It's synergyhealthdpc.com. There's a live chat bot there with one of our reps. And then it's info@synergyhealthdpc.com if they want more information. And
Perfect.
The staff can explain how it works, but we're trying to help as many people as we can. So,
well, and I hope that you expand out your model. I can see it, how easily it will be. I know that COVID, thank goodness at this time, knock on wood, people like you have gotten it raging out of control, have gotten it to chill a little bit. But I can see where your program is going to be for primary health care at the nursing home, taking care of psychologically ill patients with Alzheimer's. All of this is exciting because we could see a greater number of patients. As it is right now, I've got to go to an acute care facility as a nurse practitioner. I've got to drive over there, pump gas, go over there, go see people. Handwritten notes, it's still actually happening. And all of that, if I have been able to see them from home, read their charts, looked at them in the face-to-face, and reached the diagnosis with the nurse's help, we probably would have done it in a half to at least 30% of the time it took. And I'm just kind of guessing there, but I've used telemedicine, and that's what it takes. It's quick.
Yeah, I agree. I would like to set up special tablets in nursing homes, Joe, where all of the patients are kind of programmed in there, and then they just tap a button and then they request a consult. That's my vision for nursing homes, where the staff can literally have a device at the nursing station where they could request a consult from one of our, like an Uber driver. Yeah,
we're out of time, and but I wish we had more, but I'd like for you to come back on the program. South Texas Now, we're just a little microcosm of America, but I think that doctors like Dr. Bartlett in Texas, who took the bull by the horns, so to speak.
I could ask if maybe we get Dr. Bartlett on, Joe.
I'd love to get him on. He's a lot more handsome and speaks better than I do. I'll just make him.
I'll call him this afternoon.
Yeah, we'll make him the host. I'll fire myself. Okay, well, I'm out of time, and thanks to Elizabeth and all the gang out over there, Gillette,
Thank you.
everybody that's doing a great job, the great team at Synergy that really cares about people. Thank you, Brian.
Thanks, Joe. Have a great day.
You too.